This is Jason Sork, once again regarding health assessment. We are going to be doing an examination on the chest, the lungs, and the heart. I have again with me my father, Lendl Sork, and basically, like with anything, we would advise good privacy. We would get a history, seeing if there is anything that would be dealing mainly with the lungs, the heart, any respiratory problems, any coughing, any sinus drainage, anything out of the ordinary. I would be looking at the skin while I was talking, if Dad was my patient, checking to see if there was cyanosis, any discoloration, anything. In beginning the examination, normally I would have him wear a gown on his upper torso. I would undrape it the way I could see it. I'm going to not do that for this assessment at this time, but I'll explain what I'm doing. And what I'm doing right now is I'm going to be looking at the chest. Basically, I would be looking for any abnormalities. I would be checking to make sure that the lungs on the anterior aspect and the posterior aspect of his chest and back were symmetrical. Also, I'd be visualizing the trachea, seeing how it was. I will begin by palpating. I'm going to palpate the trachea. I would be assessing around the mid portion to see if the trachea is midline, which it is. Seems to be midline, and that is good. Another thing I'm going to be doing, I would be assessing the landmarks around the clavicular, the sternal. I would be assessing towards the back. Does it feel around the lungs? Are we dealing with anything out of the ordinary, any nodules? Now I'm going to do some percussion in just a minute, but first thing we're going to do is tactile fremitus. I'm going to lay the ulnar sides of my hands here, and I'm going to ask Dad to say 99.
99.
And again.
99.
And again.
99.
What I'm doing is I'm hearing the vibrations. They should be also symmetrical. Again.
99.
And again.
99.
Okay, now let's say I had something different. I would have my hand, I'd have him to say 99.
99.
And then I would do it again.
99.
Okay, and I would feel if there was any difference in the vibrations. That would detect probably some irregularity that we would have to go into detail with. Another thing is I want to check the chest excursion. I put my hand at the lower chest with my thumbs touching. And I'll ask you to take a deep breath and exhale. Okay, and I'm looking at my thumbs separating. Like I said, do it one more time for me, Dad. Exhale. And the same thing with the thoracic. Again. One more time for me, Dad. And you can see separates. Now, I'm going to give Dad just a moment to catch his breath. What we're going to do now, we're going to be doing some percussing. Basically, with percussion, you're checking and you should hear a resonance sound. That would indicate normal. So, for example, this is indirect. And basically, as you could hear, of course it would sound different in regard to what I'm assessing to see if there, he wouldn't have, like I said, I would be doing it on his bare back, but I would be checking. Feeling and listening to anything that would be out of the ordinary. Another thing that I was wanting to assess, unfortunately I'm having to look over my notes one more time just to remember the exact term, is I'm checking regarding the diaphragmic excursion. Now, what I'm going to do is I'm going to percuss. And I've got a ruler here, and I'm just going to pretend I'm marking. What I'm going to have you to do, Dad, I want you to take some slow deep breaths, and then I want you to hold your breath. slow deep breaths, and hold it. I go around the scapular line. Okay. Once I heard the resonance change, dull, I would mark it with a pen. Then I'm going to let Dad take a few slow deep breaths and then hold it. Okay? And hold this time. And I repeat. Okay. And then what I would do, if I had a pen, I would mark this. This would refer to diaphragmatic excursion right here. Okay. And it would be documented. Finally, I'm listening to the lung sounds. Bronchial, I would be hearing around the trachea. Basically, everything else would be bronchovesicular. Okay, take a deep breath. Exhale. Again. Exhale. Again. Again. Okay. Okay, now, I want you to raise this arm up. What we're looking at also, I needed to make mention is, besides the anterior and the posterior side, we would be looking at the lateral aspect or the transverse. And I'd also have him take a deep breath. Exhale. I'm going to skip the other side for time consumption. And again, take these slow deep breaths. Again. Again. And what I'm doing is basically listening to the upper and lower lung lobes is what you're wanting to check. You're wanting to check the upper and lower lung lobes. Okay, now, after assessment, we're going to be assessing the heart and everything. We've already assessed the chest. We've already looked at all of the aspects and landmarks of the chest. Basically, what we're going to do is we're going to be doing palpation, percussion, and auscultation. Okay, what we're checking on is 5 major points. The aortic, which is in the second intercostal space. The pulmonic, which is in the second intercostal space to the right of the sternal notch. We're going to be assessing herbs, which is in the third. And then we're going to be checking the tricuspid, which is in the fifth, and the mitral, which is on the mid-clavicular. And what I'm doing is I'm palpating. This is near the apex of the heart, and usually you're checking about the S1, S2. The S1s is usually stronger at the apex of the heart, whereas the S2s on the opposite side. So basically, what I'm going to do, I would be palpating this to assess. What I'm also doing is I'm going to be checking for carotid, carotid and temporal. Okay, the temporal, of course, is on the lateral aspects of the forehead. Okay. The carotid is right behind the sternocleidomastoid, and I can feel it. One thing you want to do is, and I would go to the other side to feel, as you can see. You don't want to do them at the same time because you're actually blocking blood flow to the brain, and you don't want anything like that to go on at that moment. Okay. What I'm going to do, I'm going to auscultate now. I would use the bell. I'd be listening. Okay. I need you to hold your breath for just a second. I'm listening for a bruit, which I don't hear. That's good. Switch it back to the diaphragm. I'm going to listen to the aortic. S1, S2. I'm listening for any skipping. I'm also checking for Is there any pausing between the S1 and S2? And finally, and I forgot to make mention, Amy, you like this, when you're palpating, of course I was palpating everything. On the apical, basically what you're doing is you're palpating around the edges of the apex, is what you're doing of the heart. I forgot to make mention about that in our assessment. Okay, basically, Dad, if you will, I want you to kind of lay back here on this pillow. This is closest to a 45-degree angle that I can get. And we're going to just check the hepatojugular and the jugular vein distension. Okay, basically with the hepatojugular, we're checking, this shows about how much your peripheral vascular pressure is. Okay, just like I said on the carotid, what you're doing is, at a 45-degree angle, you're feeling for mainly where the sternum is, where it kind of elevates, so to speak, is what I would say. Okay, this is where we would have we'd have two rulers. And what I'm doing is, I'd be feeling and looking. A lot of times you can use a pen light. When you see it, of course I'd have it right here. You'd be checking, and it looks like I'm seeing about 1.2. If it's above 4, then we've got problems. You need to do some further examinations. Usually a normal one is between 1, 2, 3.8, 3.9. 4 or above, we've got to look for it. Now on the hepatic jugular, what we're doing is, this would be assessing by me pressing down on the mid or the epigastric, holding down, and I see pulsation right here. And that is something that I need to check on also. So, in conclusion, that would pretty well be our broad spectrum assessment on the chest, lung, and heart. Thank you.